So when I think about practicing in pediatric rehab and pediatric sports medicine in the future, I always think about having strong relationships with other departments. I have seen overall there still is a gap in terms of, especially when I've worked with pediatric residents, a lot of them don't really understand still what we do, and they think of pediatric rehab as like this magic box, right? Where they think they most commonly know about the inpatient rehab facility because that's where they send patients when they're working on the floors on the acute medical services. They think about us, I think, from the consult perspective, and I like that in pediatric rehab they actually think about us a little bit more than the adult world in terms of neurostorming, more of those acute things that go on maybe in the ICU, and so I think that helps bring us in earlier. But I still think there are times where even when I was working in an institution where pediatric rehab was very well known, there still are a lot of people who don't know what we do or all the things that we can do and offer at the table. What I love about the continuum and why I chose rehab medicine over, like, let's say orthopedics, because orthopedics I could have done a lot of similar things, right? Is that not only do I get to take care of that functional aspect, but I also get to build that relationship along the continuum with all my patients and my families. And so I love seeing them from very early phases, and you're seeing them very, maybe every day sometimes or every other day, but you're really building that relationship, and then you get to see these patients go through the trajectory of either their illness or their recovery, and we get to help alongside and kind of cheer them along, but also provide them with some of our skills and some of our tools to help them along that way. And then we get to see them in the follow-up of clinics and see them back multiple times and be like, wow, I can't believe like 2 years ago this is where you were and we didn't know what was going to happen next. I definitely think collaboration is key across all physical medicine and rehab, and even outside of PM&R. We, as a specialty, I think we are much stronger